So my daughter's father suffers from DVT, pulmonary embolism. He was diagnosed when he was about 19 or 20 years old. He had a football scholarship and he was playing football one day out in the field and he fell out on the field. They rushed him to the hospital and come to find out a blood clot had reached his lung and pierced his lung and he almost, basically drowned in his own blood. It changed the trajectory of his life, and I think in many ways it was something when my daughter came along or when I found out I was pregnant that was kind of always stuck in the back of my head. They had tested her blood, you know how they test your blood when you're a baby, and hers came back saying that she had hemoglobin Barts. I would make it a point to say to her doctor, this is in her sort of genetics or whatever. Her father is diagnosed with this. So flash forward to last wellness appointment, which was in December. I brought it up again to her doctor, her pediatrician, UPMC Klein, Children and Teen. She's been going there ever since she was born. She's had this Dr. Brittany probably consistently for the past 4 or 5 years, though. Brought it up to her, and again, she kind of did the, I don't think there's anything to worry about. I'll put it in a chart. And I said, okay. I kind of told her about certain things that I noticed, like my daughter's skin or her lips would be very, very dry at times. I don't know, and that stuck out to me. Her hair texture had really changed, and just certain things that I saw as she was getting older. A month later, a email portal in the UPMC email portal from Dr. Brittany, basically saying, I decided to, discuss your daughter's symptoms and your daughter's history, blood history with, my colleagues. And they suggested that because she did test for hemoglobin Barts because of some of the symptoms that you've mentioned, maybe it'd be best for you to go see a hematologist. Megan McCormick, who we went to see, who was a pediatric hematologist. She comes to Harrisburg twice a week, but she's out of Pittsburgh. We met with her and she was very, very thorough. Finally, we did the blood test and she did the blood work and she called about a couple weeks later. All of her tests looked pretty good except for her protein C activity was extremely low. I'd like to put her on some vitamin K and see if that kind of levels out the protein C activity. And when my daughter took the second blood test, the results were the same. And so she basically said that, your daughter would be diagnosed with mild blood clotting disorder. She may never get a blood clot, she said, or she said she may start to see issues when she's in her mid to late 20s. It'll be important for her not to be on estrogen when she gets, to a stage in her life where she wants to take birth control. Or she said surgeries is when you would want to be concerned or when you would want to bring it up. And she sent through the portal, information on alpha thalassemia. And, her last words were to me, I'll never forget, was, thank you for being an advocate for your daughter. If it wasn't for you constantly bringing this up and making it a point to stress to the doctors, I don't know that we would have, caught it as early as we did. And she said, just make sure your daughter remains active. And she, treat her like a normal kid because she is a normal kid. She did lead the charge in educating us. I think she led the charge in taking my advocacy for my daughter a step further by believing in what I said in this sort of field as a doctor is to listen to your patient. And if you are a pediatric doctor, listening to the parent. Maybe not, we don't have all the education in the world. We didn't go all, go to the schools that they went to, but we know our children. Yeah, I'm a testament to their expertise. She's doing great. She's out here running track meets and she's made junior Olympics. and But she made it for the 80-meter hurdles, the 200-meter dash, and the 400-meter dash. So she will be going to Junior Olympics in Iowa. UPMC has been able to change with the times and change with the environment that we're in and accommodate whatever. I love the UPMC portal. I do. I love, the ability to go in and just read the doctor's notes, be able to refer back to the doctor's notes. I appreciate that when I called out all the way out to Pittsburgh, that my message got to me, got to Megan. Even though I saw my daughter here in the Harrisburg office, I appreciated that even the operators were like, we'll make sure that she gets the message, and they did because she called me back. There is this wholesomeness that comes with working with UPMC. They do make you feel like you care. They care, and I think that they are hiring staff that genuinely cares about the work that they do, and that the work that they put in. And I think that that's important. Nobody wants to deal with a person that doesn't really like what they do in this type of field. You know what I mean? Like, because that shows. UPMC is doing a great job with that, and I hope they continue to do a great job with that.